What are the core differences between animal rights and animal welfare, and how do these differences influence animal care practices? Answer. The concepts of animal rights and animal welfare represent two distinct ethical approaches to the treatment of animals. Animal rights. This perspective holds that animals have inherent rights similar to human rights. Advocates argue that animals should not be exploited or used for human purposes under any circumstances, whether for food, clothing, research, or entertainment. It suggests that animals have the right to live freely without human interference. Animal welfare. In contrast, animal welfare focuses on the humane treatment of animals and ensuring their well-being, acknowledges that animals may be used for human purposes such as farming or research, but stresses that they must be treated ethically. This involves providing appropriate living conditions, preventing suffering, and meeting their physical and behavioral needs. In animal care practices, animal rights often leads to an abolitionist stance, pushing for an end to industries that use animals. Animal welfare, on the other hand, advocates for improvements in living conditions and ethical treatment within existing industries. Explain the ethical considerations in animal care and how they apply to a scenario where an animal is used for research purposes. Answer. Ethical considerations in animal care are grounded in the principles of justice, beneficence, and non-maleficence. Justice, fair treatment of animals in research, ensuring that the animals are used only when absolutely necessary and that the benefits of the research outweigh the harm caused to the animal. Beneficence, the obligation to promote the welfare of animals, ensuring that their care and living conditions are optimal and that distress is minimized during research. Non-maleficence, the principle of do no harm, meaning that any harm or suffering caused to an animal must be minimized and researchers must take steps to reduce or eliminate physical or psychological pain. In research, ethical guidelines, such as the THRIAs replace, reduce, refine, are fundamental. Replace animal testing with alternative methods when possible, reduce the number of animals used to a minimum, and refine procedures to cause the least harm. The Australian Code for the Care and Use of Animals for Scientific Purposes outlines the ethical framework requiring that all research involving animals be reviewed by an ethics committee and that animal welfare is a primary concern throughout the research process. Mr. Thompson is a senior animal carer at a wildlife rehabilitation center. He notices that one of the animals, a young kangaroo, is showing signs of extreme stress after being placed in a new rehabilitation enclosure. What steps should Mr. Thompson take to address the animal's stress and improve its welfare? Answer. In this scenario, Mr. Thompson should follow the guidelines for stress management and environmental enrichment to improve the welfare of the young kangaroo. Assess the animal's environment. Mr. Thompson should first evaluate the new enclosure to identify any factors that might be contributing to the animal's stress. This could include overcrowding, inadequate space, or a lack of natural features such as hiding spots or social companions. Introduce environmental enrichment. The kangaroo's environment should be modified to include natural features that promote behavioral well-being. This could involve adding more climbing structures, plant life, and shelves that mimic the animal's natural habitat, thereby reducing stress and improving the animal's comfort. Monitor and minimize stresses. Mr. Thompson should observe the animal's behavior closely to identify any potential sources of stress, such as loud noises, human presence, or inappropriate handling, and work to reduce these triggers. Socialization. If appropriate, the animal may benefit from socializing with other kangaroos. However, any new socialization should be done carefully to prevent aggression or further stress. Consultation with a veterinarian or behaviorist. If stress persists, consulting a veterinarian or animal behaviorist might be necessary to ensure the animal's physical and emotional health are being adequately addressed. The 5 freedoms should guide Mr. Thompson's approach. Freedom from fear and distress. Freedom from discomfort. Freedom to express normal behavior. What are the 5 freedoms of animal welfare, and how do they apply to the care of companion animals such as dogs and cats? Answer. The 5 freedoms provide a comprehensive framework for understanding animal welfare, ensuring that animals live in conditions that support their physical and psychological needs. Freedom from hunger and thirst. Animals should have access to a sufficient quantity and quality of food and water to maintain health and well-being. Freedom from discomfort. Animals should have an appropriate environment, including shelter and a comfortable resting area to protect them from discomfort. Freedom from pain, injury, or disease. Animals should be protected from physical harm, injury, and illness. This includes providing veterinary care when needed. Freedom to express normal behavior. Animals should have enough space, proper facilities, and company of their own kind, if appropriate, to express natural behaviors such as playing, socializing, and exercising. Freedom from fear and distress. Animals should be provided with a stable, non-threatening environment where they do not experience fear, distress, or anxiety. For companion animals like dogs and cats, this framework translates to providing regular meals and access to clean water, adequate space for movement and play, regular veterinary checkups and prompt medical attention when necessary, opportunities to engage in behaviors such as playing, climbing, scratching, or socializing with humans and other animals, a calm, safe, and supportive living environment free from excessive noise or stress. Mrs. Lee is a dog owner who has just adopted a puppy. She notices that the puppy is becoming fearful of strangers and loud noises. What are some behavioral needs of the puppy that Mrs. Lee should address, and how can she reduce the puppy's stress? Answer: Mrs. Lee should address the following behavioral needs of the puppy. Socialization. Puppies need to be properly socialized during their early developmental stages. Exposure to a variety of people, environments, and experiences will help the puppy become well-adjusted and reduce fear of strangers and new situations. Positive reinforcement. Mrs. Lee can use positive reinforcement techniques, such as treats and praise, to reward calm behavior when the puppy encounters strangers or loud noises. This will help the puppy associate these situations with positive outcomes. Gradual exposure. Gradually desensitizing the puppy to stressful situations like loud noises by exposing it to these triggers in a controlled, calm environment will reduce fear over time. For example, playing recorded sounds of thunderstorms at a low volume and gradually increasing the volume can help the puppy become less fearful. Secure environment. Ensure the puppy has a safe and quiet space where it can retreat when feeling stressed or scared. A crate or a designated safe zone can provide comfort. By addressing the puppy's behavioral needs and applying stress reduction techniques, Mrs. Lee can ensure the puppy develops into a confident, well-adjusted dog. Explain the ethical treatment of animals in different environments with a focus on farm animals versus zoo animals. Answer: the ethical treatment of animals differs based on their environment and the purposes they serve. Farm animals. Ethical treatment in farming environments requires that animals are raised in conditions that meet their 5 freedoms. This includes providing enough space, access to clean water and food, and proper shelter. Additionally, farm animals should be free from cruel practices such as factory farming or inhumane slaughtering methods. Ethical farming practices advocate for free-range or organic farming systems where animals can exhibit natural behaviors. The Australian Animal Welfare Standards and Guidelines for the Care and Use of Farm Animals provide a regulatory framework to ensure their humane treatment. Zoo animals. In zoos, animals should have enriched environments that allow them to express natural behaviors. This involves designing enclosures that mimic their natural habitat and offering opportunities for mental and physical stimulation. Ethical concerns include providing adequate space, socialization opportunities, and enrichment activities to prevent stress and psychological harm. While zoos serve educational and conservation purposes, critics argue that keeping animals in captivity for entertainment purposes raises ethical issues. What role do animal carers play in maintaining animal health and welfare, and how do they ensure compliance with relevant animal welfare laws? Answer: animal carers are responsible for ensuring the physical and psychological well-being of the animals in their care. Their key roles include health monitoring, regular checks on the animal's health, including monitoring for signs of illness, injury, or distress. Carers must administer medications as required and seek veterinary care when necessary. Providing enrichment, ensuring that animals have adequate space, exercise, and mental stimulation. This may include interactive toys, social interactions, and appropriate environmental setups. Handling and training. Proper handling and training are vital to ensuring the animal's welfare. Carers should use positive reinforcement techniques and avoid any methods that could cause harm or distress. Record keeping and reporting. Maintaining records of the animal's health, behavior, and welfare status. Any changes or concerns should be documented and reported to a supervisor, veterinarian, or regulatory authority. How does understanding animal behavior help in stress management and improving welfare, particularly in a shelter environment? Answer: understanding animal behavior is crucial for identifying signs of stress and improving animal welfare, particularly in a shelter environment where animals may be exposed to new stresses such as unfamiliar sounds, crowded conditions, or changes in routine. Behavioral signs of stress. Animals under stress may exhibit behaviors such as excessive barking, withdrawal, aggression, or self-mutilation. Recognizing these signs enables carers to intervene early and reduce stressors. Environmental modifications. Understanding how animals respond to their surroundings helps carers create environments that meet their behavioral needs. For example, giving animals enough space, hiding spots, and opportunities for exercise can reduce stress. Predicting behavior. By understanding an animal's natural instincts and species-specific behaviors, carers can predict potential problems G. Aggression or anxiety, and implement strategies to prevent these issues before they escalate. Training and socialization. Behavioral understanding allows for targeted training programs that promote positive behaviors and reduce anxiety in shelter environments. Socialization with humans and other animals is key to ensuring a calm and non-stressful environment. How do historical developments in animal welfare laws impact current practices in animal care? Answer: historical developments in animal welfare laws have shaped contemporary standards and practices in animal care. Early laws. Early laws focused primarily on preventing cruelty to animals. The Cruelty to Animals Act 1835 UK marked one of the first significant legal efforts to protect animals from cruelty, particularly in the context of dog fighting. Mid-20th century developments. The 20th century saw a more structured approach, with animal welfare laws evolving to address issues like factory farming, laboratory testing, and the use of animals in entertainment. In 1966, the Animal Welfare Act in the US set standards for the treatment of animals in research, exhibitions, and transport. Modern legislation. Today, laws like the Australian Animal Welfare Standards and Guidelines provide comprehensive guidelines that address the health, safety, and ethical treatment of animals across different environments. These regulations enforce compliance with minimum care standards, promoting the humane treatment of animals and ensuring their welfare in all settings, from farms to zoos and research facilities. Historical legal developments have resulted in a more nuanced understanding of animal welfare and a commitment to improving conditions for animals in both public and private sectors. What are the responsibilities of an animal carer when faced with an injured or sick animal in their care, and how should they manage the situation while ensuring compliance with animal welfare laws? Answer: when faced with an injured or sick animal, an animal carer has several key responsibilities. Immediate care. The carer must first provide immediate first aid to stabilize the animal's condition. This may involve cleaning wounds, administering basic treatments, or preventing further injury. Veterinary care. The carer should quickly contact a veterinarian for further diagnosis and treatment. If the animal's condition is severe, the carer should follow protocols for emergency veterinary care. Record keeping. The carer should document the animal's injury, symptoms, and treatment. Detailed records ensure that the situation is handled properly and provides a history for future reference. Compliance with welfare laws. The carer must ensure that all actions taken comply with the Animal Welfare Act and other relevant legislation which mandates the humane treatment of animals and the provision of necessary medical care. This includes notifying authorities if the injury was the result of abuse or neglect. Describe the reproductive cycle of a typical domestic dog and explain how it varies from the reproductive cycle of a cow. What are the key factors that influence the timing of reproduction in these animals? Answer: the reproductive cycle of a domestic dog consists of 4 stages: proestrus, estrus, destrus, and anastrus. The proestrus phase is marked by swelling of the vulva and discharge, indicating that the female is entering heat. Estrus is the mating phase, when the female is receptive to the male. Distress occurs after mating, where the female either carries the pregnancy to term or undergoes a pseudo-pregnancy. Anastrus is the resting phase, when the female is not sexually active. In contrast, cows have a menstrual cycle that is typically 21 days in length, with estrus occurring at the start of the cycle when the female is fertile and will stand to be mounted by a bull. The cow's cycle includes the follicular phase before ovulation, and luteal phase post-ovulation. Factors influencing reproduction in both species include hormonal regulation, e.g., progesterone, estrogen, environmental conditions, nutrition, and health status. The timing of reproduction in dogs can also be influenced by breed. While cows' reproductive timing is typically controlled through farm management practices like artificial insemination. What are the advantages and disadvantages of artificial insemination (AI) in livestock breeding, and how does it compare to natural breeding methods? Answer: artificial insemination (AI) in livestock involves collecting semen from a male and manually introducing it into the female's reproductive tract. AI offers several advantages. Genetic improvement. AI allows for the use of superior genetics from males with desirable traits, even if the male is located far away, expanding genetic diversity. Disease control. AI reduces the risk of disease transmission between animals since it eliminates direct contact. Control breeding. It allows for better control over breeding timing and management. However, there are disadvantages. Technical expertise. AI requires skilled technicians for semen collection, handling, and insemination, which can be costly and labor-intensive. Low success rates. Compared to natural mating, AI can have low conception rates, especially in certain species or under poor management practices. Cost of semen and equipment. AI requires the purchase of semen and specialized equipment, which may not be economical for small-scale breeders. What are the ethical considerations involved in the breeding of companion animals, and how should animal welfare be prioritized in these practices? Answer: ethical concerns in companion animal breeding include genetic disorders. Breeding for specific traits, e.g., physical appearance, may result in genetic disorders such as hip dysplasia in dogs or brachycephalic syndrome in certain breeds. Ethical breeders should prioritize the health of the animals and breed only those with good genetic backgrounds. Overpopulation: there is an ethical dilemma in breeding animals while shelters are overrun with animals in need of homes. Breeders should be responsible and consider adopting from shelters over producing more animals. Animal welfare: the breeding process itself should be managed with the physical and mental health of the animals in mind. This includes providing proper prenatal care and ensuring that the animals live in a healthy, safe environment. To prioritize animal welfare, breeders must adhere to animal welfare guidelines and consider the broader ethical implications of their breeding decisions. Mr. Anderson is a breeder of pedigree dogs and has noticed that one of his dogs, Daisy, is showing signs of joint discomfort. Daisy's father had a history of hip dysplasia, a genetic condition that affects the hips. Mr. Anderson is considering breeding Daisy to a dog with no history of genetic conditions. What should Mr. Anderson do to ensure that Daisy's health and welfare are prioritized in the breeding decision? Answer: Mr. Anderson should consider several key actions. Health testing: he should have Daisy undergo a thorough veterinary examination, including joint assessments and screening for any genetic conditions such as hip dysplasia. This helps ensure that Daisy is in good health before breeding. Genetic testing: it is crucial for Mr. Anderson to perform genetic testing to identify if Daisy is a carrier of hip dysplasia or any other hereditary condition that could be passed to her offspring. He should also test the potential sire for similar conditions. Ethical breeding decisions: if Daisy is found to have a predisposition to hip dysplasia, it may be unethical to breed her as it would perpetuate the genetic issue. Mr. Anderson should prioritize animal welfare over breeding for profit and consider whether the breeding decision is in Daisy's best interest. Relevant guidelines: law. UK Kennel Club breeding standards requires breeders to conduct health screenings for common genetic disorders in dogs before breeding. Animal Welfare Act 2006 UK. It ensures the protection of animals from harm and requires breeders to consider the health and welfare of animals in their care. Compare and contrast positive reinforcement and clicker training methods in animal behavior modification. Which situations are best suited for each method? Answer: positive reinforcement. This training method involves rewarding desirable behavior to encourage its repetition. Rewards could be in the form of treats, praise, or toys. It is effective in creating a positive learning environment where the animal associates good behavior with rewards. It is often used in training dogs, horses, and other pets. Advantages: it encourages the animal to engage in desired behaviors without fear or stress. It helps build trust between the animal and the trainer. Disadvantages: it requires consistency in rewarding the behavior and may take longer to achieve results if rewards are not properly timed. Clicker training: a form of positive reinforcement. Clicker training uses a distinct sound, the click, to mark the exact moment a behavior is performed correctly. The click is followed by a reward. Advantages: the precise timing of the click helps the animal understand exactly which behavior is being rewarded. It is highly effective for complex tasks and tricks. Disadvantages: the trainer must carry a clicker and it may require more skill to master than simple positive reinforcement. Best situations: positive reinforcement is ideal for general training and building relationships with pets, while clicker training is particularly effective in teaching specific behaviors or in animal rescue situations where precision is critical. Relevant guidelines: RPA's guidelines on training emphasizes the importance of humane, reward-based training methods. Animal Welfare Act 2006 stipulates that animals must be trained in a way that does not cause distress or harm. What are the key strategies for addressing aggression in domestic dogs, and how should an animal welfare professional ensure that the methods used are ethical? Answer: to address aggression in dogs, several strategies can be employed. Behavioral assessment: a professional should first assess the cause of the aggression, such as fear, territorial behavior, or resource guarding. Understanding the root cause is essential for choosing the right approach. Desensitization and counter-conditioning: this involves gradually exposing the dog to situations that trigger aggression while pairing them with positive experiences, thus reducing the aggressive response. Positive reinforcement: rewarding calm behavior and redirecting aggression to more desirable activities, Fetching or playing can be effective. Professional training. Aggressive dogs should be handled by professionals who are trained in animal behavior and welfare, ensuring the methods used do not exacerbate the problem or cause additional harm. Ethical considerations. The methods should be humane and avoid physical punishment, as this can increase anxiety and aggression. The welfare of the dog must always be the priority, and training should be focused on long-term positive change rather than immediate behavioral suppression. Explain the importance of early socialization for puppies and kittens and how it impacts their behavior in adulthood. What are the key principles of effective socialization? Answer: early socialization is critical in shaping a well-adjusted adult animal. For puppies and kittens, exposure to a variety of people, animals, sounds, and environments during the critical window, approximately 3–4 weeks, helps prevent behavioral problems such as fear, aggression, separation anxiety, and fear of unfamiliar situations. Key principles of effective socialization include positive experiences. Ensure that interactions with new stimuli are positive and rewarding, using treats and praise to reinforce calm behavior. Gradual exposure. Slowly introduce the animal to new experiences to avoid overwhelming them. Early positive experiences help them develop confidence. Consistency. Socialization should be a regular part of the animal's daily routine, ensuring they encounter a wide range of situations. Failure to socialize properly can lead to adult behavior problems such as anxiety or aggression toward unfamiliar stimuli. What are the key aspects of pregnancy care in rabbits, and how should an animal welfare professional manage parturition to ensure the health and safety of both the mother and the kits? Answer: pregnancy care in rabbits involves proper diet. Pregnant rabbits require a balanced diet rich in fiber to support their pregnancy. Fresh vegetables and a small amount of high-quality pellets are ideal. Health monitoring. Regular checkups to monitor the health of the doe female rabbit and detect any complications. Preparing a nesting area. Before giving birth, the doe needs a quiet, clean, and safe space to deliver her kits. Providing bedding material like hay allows the doe to build a nest. Monitoring parturition. Rabbits typically give birth in a short, relatively uncomplicated process. The professional should monitor the doe and ensure she has access to food and water post-delivery. Postpartum care. After birth, the professional should ensure the doe is not stressed and that the kits are nursing properly. Relevant guidelines. Lauropia's Rabbit Care Guidelines provides detailed information on pregnancy and parturition care for rabbits. What are the challenges of training animals in rescue and rehabilitation settings, and how do these challenges differ from conventional training environments? Answer: training animals in rescue and rehabilitation settings present several unique challenges. Emotional trauma. Animals in rescue situations may have experienced neglect, abuse, or abandonment, leading to fear, anxiety, or distrust of humans. Training must be slow, patient, and trauma-informed. Behavioral issues. Many rescue animals may have ingrained behavioral problems such as aggression, fear, or separation anxiety, which require specialized training techniques. Resource limitations. Rescue centers often have limited time, staff, and funding, which can limit the types of training available to each animal. Trainers may need to rely on basic, low-cost methods. These challenges differ from conventional training environments where animals are typically more trusting and stable. In rescue settings, the emphasis is on rehabilitation, which often requires addressing psychological issues alongside physical training. Relevant guidelines. RSPCA Guidelines on Rehabilitation provides best practices for rescuing and rehabilitating animals, ensuring that psychological and physical needs are met. What are some common breeding-related health risks in cats, and how should a breeder manage these risks to ensure the health and welfare of the kittens? Answer: common breeding-related health risks in cats include genetic disorders. Breeding purebred cats can sometimes lead to hereditary conditions such as heart disease, hypertrophic cardiomyopathy, or kidney issues. Breeders should conduct genetic testing to identify these risks. Inbreeding. Inbreeding can result in weakened immune systems or other genetic issues. Breeding from unrelated lines reduces this risk. Maternal health. Pregnant cats may face health complications like toxemia or uterine infections. Ensuring good nutrition, regular veterinary checks, and a stress-free environment is essential. Complications during birth. Dystocia, difficult birth, can occur, requiring veterinary intervention. Breeders must prioritize health screenings, careful pairing, and the overall welfare of both the mother and the kittens. Explain the nutritional differences between herbivores, carnivores, and omnivores, focusing on their digestive systems and dietary needs. Why is it crucial to understand these differences when designing a diet plan for animals in captivity? Answer: herbivores, such as cows and rabbits, primarily consume plant-based diets and have digestive systems adapted to extract nutrients from fibrous materials. They possess large, complex digestive tracts, including a cecum or rumen where fermentation of cellulose occurs. Their diets are high in fiber and low in fats and proteins. Carnivores, like cats and eagles, have shorter digestive systems optimized for protein and fat digestion. They possess sharp teeth and digestive enzymes that break down animal tissue efficiently with high protein and fat requirements. Omnivores, such as humans and pigs, have versatile digestive systems capable of processing both plant and animal-based foods. They have a relatively more balanced diet that includes protein, carbohydrates, fats, and fiber. Understanding these differences is critical for creating appropriate diet plans in captivity. For example, herbivores require high fiber and low protein, while carnivores need more meat-based protein. Omnivores need a balanced combination of both, but feeding a carnivore plant-based food can cause nutritional deficiencies such as taurine deficiency in cats. To discuss the specific nutritional requirements for a young, growing dog compared to an older adult cat, include factors such as protein, fat, minerals, and vitamins. Answer: growing dogs have higher nutritional needs than adult cats, particularly in terms of protein, fat, and minerals like calcium and phosphorus. For puppies, the diet should consist of 2–32% protein and 8–22% fat to support their rapid growth and muscle development. These levels are higher than those required by adult dogs, as they need more energy for cellular development. Additionally, calcium and phosphorus levels should be higher for bone development. In contrast, adult cats have lower energy needs but require higher protein levels, around 30–40%, to maintain muscle mass. Older cats may need diets lower in fat and calcium to prevent kidney strain, a common issue in aging felines. They also benefit from taurine, an essential amino acid, and vitamin supplementation, as older cats may not synthesize these as efficiently. Overall, a growing dog needs a diet rich in protein, fat, and minerals, while older cats require a diet tailored to their slow metabolism with fewer calories and higher protein to maintain muscle and organ function without overwhelming the kidneys. Explain how to interpret animal food labels and product ingredients to ensure they meet the nutritional needs of animals in your care. What regulations must be followed in labeling these products? Answer: animal food labels must follow regulations set by the Association of American Feed Control Officials, OFCO, which provides guidelines for guaranteed nutrient levels. Labels should clearly list guaranteed analysis, which includes the minimum percentage of crude protein, crude fat, fiber, and moisture. Ingredients are listed in descending order of weight, with primary ingredients being the most substantial components. It is important to verify that the diet is labeled as a complete and balanced, meaning it contains all essential nutrients required for the specific animal, e.g., cats or dogs. Additionally, labels should mention any added vitamins or minerals, such as taurine for cats or omega-3 for dogs. The Federal Food, Drug, and Cosmetic Act (FDA) requires that labels not be misleading and accurately represent the nutritional content. It is crucial to ensure that the diet meets the OFCO's nutrient profiles for the specific life stage of the animal, e.g., growth maintenance or senior. For instance, a cat's food must include the correct levels of taurine and vitamin A, as deficiencies in these can lead to severe health issues. Therefore, understanding labels ensures animals receive the proper nutrition for their health and well-being. Discuss the role of vitamin A and vitamin D in animal diets and the risks associated with excessive supplementation in animals. Provide examples of scenarios where additional vitamin supplementation might be necessary. Answer: vitamin A plays a crucial role in maintaining healthy vision, immune function, and skin integrity. It is particularly important for species like cats, which require preformed vitamin-quist retinol from animal tissues, as they cannot convert beta-carotene from plants into active vitamin A. Excessive vitamin A supplementation, however, can lead to toxicity, causing symptoms such as lethargy, bone deformities, and hair loss. Vitamin D is vital for calcium absorption and bone health. Animals that are not exposed to sufficient sunlight, e.g., indoor cats or reptiles, may require additional vitamin D supplementation to avoid deficiencies, leading to conditions like rickets or osteomalacia. However, excess vitamin D can cause hypocalcemia, resulting in kidney failure, calcification of soft tissues, and other complications. Supplementation is necessary in specific scenarios, such as for animals in low light conditions during growth periods or those with certain illnesses. However, improper dosing can have serious consequences, so it is essential to consult with a veterinarian before supplementing any vitamins. You are caring for a young shelter cat that has been fed a homemade diet consisting only of cooked chicken and rice for the past month. The cat has started losing weight, appearing lethargic, and has developed dull fur. What nutritional imbalance should you suspect, and what steps should you take to correct it? Answer: the cat is likely suffering from a nutritional imbalance, specifically a taurine deficiency. Taurine is an essential amino acid for cats, critical for heart health, eye function, and overall growth. The diet of cooked chicken and rice lacks sufficient taurine, which is found in higher concentrations in organ meats and certain animal tissues. Additionally, the diet may be deficient in other essential nutrients like calcium and vitamins, and D, which are crucial for bone health and overall well-being. To correct this imbalance, consult a veterinarian and provide a balanced commercial cat food that is formulated to meet all of the cat's nutritional needs. A properly balanced diet should include taurine, essential fatty acids, and all necessary vitamins and minerals. Until the cat's condition improves, supplementation of taurine and vitamin may be recommended, but it is essential to follow veterinary guidance. This case highlights the importance of ensuring that homemade diets are nutritionally complete, as deficiencies can lead to significant health issues in cats. Describe safe handling techniques for restraining a fearful dog with no known behavioral issues. What tools and methods should be used to prevent injury to both the handler and the animal? Answer: for a fearful dog, the approach should focus on minimizing stress and building trust. Avoid sudden movements and loud noises, as they can heighten anxiety. Begin by using a calm, soothing voice and allowing the dog to approach you. Your harness, as it distributes pressure evenly, minimizing strain on the dog's neck, which is especially important for fearful or stressed dogs. A non-restrictive leash should be used to guide the dog gently without applying excessive pressure. Avoid using choke chains or prong collars, as they can increase fear and may cause physical harm. The handler should maintain a relaxed posture and avoid direct eye contact, as this can be perceived as a threat. If the dog is highly fearful, consider using a muzzle to prevent biting, but ensure that it is properly fitted, allowing the dog to breathe and pant. The goal is to handle the dog with care, using techniques that ensure both the dog's and handler's safety. Discuss various restraint methods for animals like birds and reptiles that are particularly fragile. Why are traditional restraint techniques unsuitable for these species? Answer: birds and reptiles have delicate structures that require special care during handling and restraint. For birds, gentle handling with one hand around the body and the other supporting the wings prevents stress and injury. Birds should never be gripped too tightly, as this can cause damage to their internal organs or restrict airflow. Restraining reptiles requires even more caution, as many species have sensitive spines and can easily suffer from fractures or internal injuries. The best method for restraining reptiles is to support their body along its length, using both hands to avoid pressure on their vital organs. Traditional restraint methods like grabbing or squeezing are unsuitable for these species, as they can cause severe trauma, stress, or even death. Instead, using soft, padded materials or special restraining devices designed for these animals, such as cloth or customized restraint tubes, minimizes injury. Understanding the species' vulnerabilities is key to ensuring safe and effective restraint without causing harm. Explain the proper use of muzzles in handling animals, including when they are necessary and how they can be applied safely. Include examples of potential risks and precautions. Answer: muzzles are used primarily to prevent biting or aggressive behavior in animals, especially dogs. The key is selecting the right type of muzzle. Basket muzzles are the safest, allowing the animal to breathe, drink, and pant while limiting its ability to bite. They should be fitted properly to avoid excessive tightness, which can cause discomfort or hinder breathing. Cloth muzzles, while effective at preventing biting, can be restrictive, and caution is required to ensure they do not impair the animal's ability to breathe. Muzzles should only be used as a short-term solution and never as a substitute for behavior modification or professional training. In situations where muzzles are necessary, such as during veterinary visits or handling aggressive animals, slowly desensitize the animal to the muzzle by associating it with positive reinforcement like treats. Muzzles should never be left on for long periods, as they can cause stress or harm. Also check for any signs of distress in the animal, such as excessive drooling, labor breathing, or attempts to escape the muzzle. Always monitor the animal closely while it is wearing a muzzle. Describe the importance of vaccinations in animal health. Which diseases are most commonly vaccinated against, and what are the potential risks of not vaccinating animals? Answer: vaccinations are essential for preventing the spread of contagious diseases in animals, particularly in populations where animals are in close contact. For dogs, common vaccines include those for rabies, parvovirus, distemper, and hepatitis, which protect against life-threatening viral infections. For cats, core vaccines include feline panleukopenia, feline herpesvirus, calicivirus, and rabies. Not vaccinating animals exposes them to the risk of contracting serious diseases, some of which can be fatal or lead to long-term health issues. For example, parvovirus in dogs can cause severe dehydration and intestinal damage, while rabies is almost always fatal once symptoms appear. Vaccination not only protects individual animals but also helps to control the spread of diseases within the broader animal community. The risks of not vaccinating are severe, as unvaccinated animals can contribute to outbreaks of diseases that could have been prevented. Regular veterinary checkups and adhering to vaccination schedules are necessary to ensure the animal's continued health and safety. Discuss the process of diagnosing a common disease in pets, such as canine parvovirus, and the treatment options available. Answer: canine parvovirus is a highly contagious viral infection that affects dogs, especially puppies. Symptoms include severe vomiting, diarrhea, often bloody, lethargy, and loss of appetite. Diagnosis is typically made based on clinical signs and confirmed through a fecal test or a blood test for the virus. Immediate treatment is crucial, as the virus can lead to severe dehydration, shock, and even death. Treatment generally involves supportive care, including intravenous fluids to combat dehydration, anti-nausea medication, and antibiotics to prevent secondary bacterial infections. No specific antiviral treatment exists, so supportive care is the cornerstone of managing the disease. Puppies with parvovirus should be hospitalized for close monitoring and intensive care. The prognosis for parvovirus is better when treatment is started early, and mortality rates are significantly reduced with prompt veterinary intervention. Vaccination is the best prevention for parvovirus, and puppies should receive their vaccines according to the recommended schedule to avoid this dangerous disease.